Hey, what's up? This is Emily, your ultrasound business coach, helping you learn how and why you should start your own ultrasound business. If you're new here to the channel and you like the idea of starting your own business, please consider subscribing so you don't miss any future videos. In this video, we're going to cover the most commonly asked questions we get when it comes to the most effective business models that we use in our ultrasound business today. So we've had our business for 5 years, and I believe that we have found the most effective business model, not chasing insurance and no hourly pay. So a lot of people do believe that you have to charge an hourly rate and then have the physician's office bill insurance. We started with that business model. It was an easy sale because the doctor is directly billing insurance, and it seems like it's just all going to flow. But we found out very quickly that most providers do not have the patient load to sustain 2 days a week, which would be $800 for the day, right? So you're at $100 to $125 an hour doing 2 patients an hour. Their return on that is minimal, but it is better than just referring out, right? So you're banking on them having at least 32 patients a week to send you, and most family practices just simply don't have that volume. You do run into a little bit of instability with the income there. I personally don't do that one at all anymore. I've completely revamped my business. So we do multiple business models, but the one that I focus on the most and that I'm super excited about is the screening services. It's all cash. You're not waiting on hourly pay. You can knock out 4 exams in an hour, and you're charging a cash price and the physician's charging a cash price. So it doesn't get sticky. There's just no waiting on insurance, hoping that it gets reimbursed the amount that your Medicare rate is saying that it is, and then everybody's just happy with a cash price. So I tell everybody that's thinking about going into ultrasound as an industry that it is a lot different now. So at least in our area, you have 3 schools with 15 to 20 students graduating each cohort, and the job openings are not there. So there's about 2 to 4 job openings maybe in the area, and you have all of those students competing for that job. You have to take into consideration that ultrasound is the imaging modality that really takes skill. So we're not, believe it or not, just pushing buttons. You actually have to know how to get the anatomy, what you're looking at, and how to explain when you see normal versus abnormal. So if you aren't navigating on the patient correctly and you don't find it, then the radiologist won't see it. Versus CT or X-ray, you have the patient in one position and you're actually clicking the button and relying on the radiologist to then see it. So they see what you see, which is not ever changing because you're not moving around. So in ultrasound, they only see what you see, but it is changing and it is dependent on the tech. So hospitals, imaging centers are very picky. They want their students or new hires, they want their new hirees to have experience. And that is where it gets tough. When you're fresh out of school, a lot of them don't want to take the time to train because then they have to constantly overcorrect, or it just takes a lot of time. And so they look for experienced sonographers. And if you don't ever go get that job, nobody ever hires you, then it's really hard to have that experience. Yes, you get experience in your clinicals, but for most places hiring, that's not enough. I am a huge advocate that if you're going into sonography, you should 100% start your own business. Even if you do want to get a job later, starting your own business establishes that experience with the provider, with the patients, and on your resume. So essentially, even getting 1 office per month doing a screening service, you can make $2,000 for that 1 office. That's 1 day out of the month that you're working to make $2,000. Now, if you have 1 office per week, which is 100% doable, we're getting new offices every single week. We're closing new offices. And that's the really exciting part, is that when you have someone that's mentoring you or teaching you sales, you want to make sure that they're actually doing that too. They're actively in the field so they know what's working and not working. So say you go into ultrasound and you right off the bat know that you don't want to work at a hospital or an imaging center. You want to work 1 day a week. So screening services would be the best route to go into because you're going to max out that pay, and it's a cash pay. So you're not chasing insurance on it. You can make $2,000 to $3,000 per week, depending on the market value for the service that you're selling. So the way that it works is we charge a price to the physicians, a cash price, flat rate. They then make their own price for the ultrasound. And the way that they can do this is because it is a screening service. A lot of these aren't covered by insurance, so they are preventative, and that brings in a revenue for them as well as keeping us that flat cash price that we're not waiting on insurance to receive. So a little story time. I actually started my business by going into a physician's office and doing an hourly rate. I think I was making around maybe $2,500 a month, maybe $3,000 going in twice a week. I would have random sporadic breaks within my day. Just the patient load wasn't there. But we did it for about a year. And then we realized very quickly that there was some errors in the billing. So the price that we had thought they were going to get reimbursed wasn't the price that they were actually getting reimbursed. And the monthly check-ins or whatever it was wasn't happening. We weren't told or taught to check in. We just thought that the biller knows to obviously check that they're getting reimbursements. So I think it's so important that whatever route you go with ultrasound, you have a mentor that is navigating that aspect of it too. So when you have your own business, you become that salesperson. And if your mentor isn't teaching you how to be the best salesperson and the best business person, you're going to fall through the cracks. And you want to establish these provider relationships where they trust you enough and you care enough to actually check in and make sure that everything that you said was going to happen is happening. And I think that it's important to have a mentor that holds you accountable in that area. What we teach to our ultrasound students that are wanting to start their own business is to navigate the business models that bring in cash flow right away rather than waiting on insurance. We actually don't handle insurance at all, and we've been able to scale our business to $500,000 just last year. So it is 100% possible, and in my honest opinion, it's better this way because it's very simple. It doesn't get sticky. It's not messy waiting for the complexity of the contracts for insurance and reimbursements and all of the stuff that comes along with that. You have to follow certain laws and you have to be in compliance. And to me, it's just hasn't been worth it. We've tried it, we've done it, and we found a better way. So I actually teach the business models that bring in cash right away. And I also teach students to do this with less than $5,000. So we believe that you can start your business with screening services and start with a butterfly probe or a handheld device because all you're needing is one service. So for example, carotid IMTs. We partner with a company that does carotid IMTs. And this has been a game changer for our business. So we can actually start a business for less than $5,000, getting that carotid IMT scan probe that you need. You need a linear probe, and you can do this with a butterfly probe or a couple of the other ones. So you don't have to invest the $10,000 to $20,000 to $30,000 on a machine to start to bring cash flow in. And this is actually the highest ROI. So picture this, you start your ultrasound business with a transducer and a machine that is less than $5,000, and you're going into offices and making $2,000 a day on selling a screening service that is cash pay. I know it sounds crazy, but this is the way to go. And this is why I teach my students this. Here's the tough part. You have to remember that this is sales. So you're essentially going into a medical sales field where you're selling a service to the provider. So not only do you have to know how to scan and do the business aspect, but you have to know the sales and you have to be good at that. And so that's what we really focus in on is the sales training specifically for women, because I think that men have a different way to target sales and they have to be a little bit more masculine and kind of aggressive. And I think that women have this area where they really need to hone in on their abilities to be sophisticated and sell in a way where it shows compassion and that we actually care. And so that's the advantage that we have as women. And I am so excited to teach sonographers around the world how to do this because literally anybody can do it. We go through the protocol, we go through the training as far as what you need to make sure that you're looking at for the ultrasound side, the business side, and then the sales training. And we're actively doing it too. So we're closing about one office per week. And we are continuing to grow that aspect of it. We want to 100% just max out our area before we move on to more states. But I also want to teach my sonographers that are in other states. This is yours if you want it. I'm going to teach you how to do it and you can go get it. A lot of sonographers think that you have to spend $10,000 on a course and $20,000 to $30,000 on a machine to start your business. And so you're about $40,000 in the hole. And I'm sure on top of student loans or whatever else you have going on, that's kind of a really big commitment for something that's only going to bring you in maybe $2,000 to $4,000 a month, doing it at a physician's office for insurance or waiting for them to bill insurance. So the model that we teach is strictly for cash pay. Every business model that we have covers the cash pay. If you want to go into an office and do it for insurance and follow the contracts and the legal compliance that goes with that, we can help that, but we don't recommend that, nor do we push that. We've done it and we found that these screening services and cash pay services are the absolute way to go. Think about it this way. If you're a sonographer, you obviously have the ability and the knowledge to be able to start your own business. You just need the avenue to do it. So you need the mentor, you need the machine, and then you need the mindset. So we teach all of that. And the exciting part is that we actually teach you how to do this with minimal investment, with max ROI. So our students are investing less than $5,000 for a butterfly probe and starting their business with a screening service that strictly uses the butterfly probe. And they're actually getting their ROI within their first 3 months, which is absolutely amazing and crazy to think that you could be turning a profit from your business in 3 months rather than spending years trying to pay off the initial investment and hoping to turn a profit within a couple years. I think that in the ultrasound industry, you should have your own business, whether you're working in a hospital or an imaging center, because having your own business is always going to offset that ability to make more money. So if you're working overtime, and especially moms, as a mom, I can understand the desire to get out of working overtime. Say you're working overtime 4 days a week. You're missing out on crucial moments with your kids. And if you could go into an office one time a month and offset that income that you're looking to work overtime for, it would be life-changing for you. Even one office a month. And you could still do that while having your current job and current benefits. So there's something for everyone in ultrasound, which is what I love, because ultrasound is such a versatile area where you can go into different avenues. We have nursing home, 3D, 4D, electives, self-pay referral. We have the screening services where we're going in and doing it at a cash pay price. And then, of course, you can go in and do the insurance model, but we don't recommend that one. We found it to not be as efficient in getting your ROI. We have an ultrasound student that just closed an office last week after starting their business 3 weeks ago, which is super exciting because this office is going to bring them in $2,000 a month just working 1 day a month. So that actually covers their machine fee and profit. So if you are a sonographer and you have at least $5,000 to invest and you've always wanted to start your own business, whether it be for just cutting back on the overtime hours that you're currently putting in, time freedom, or you just want to make more money, we have a program for you that you can go through, and we will teach you everything that you need to know from the ultrasound side of it, the protocols, to the avenues that we have that are strictly cash pay, to the sales training, which is the most important part because your mindset has to be in it. So if you have a willingness to learn and to be coachable and to grow in that area, absolutely we can help you. Just apply for our program and we will get you plugged in.